The health department says the state's expanded testing is partly why they're reporting 277 new cases today, bringing the state's total to more than 1,700.
Unfortunately, the Department of Health says another 8 people have died because of the virus. So far, 43 Rhode Islanders have lost their lives as a result of COVID-19, many of them residents of nursing homes or other congregate living facilities. Number of people in the hospital has also increased. The health department says it's now at 160.
Also tonight, Governor Raimondo says the state will take a harder line on people caught violating quarantine orders. Eyewitness News politics editor Ted Nesi joins us live from the State House with what else the governor had to say this afternoon. Ted?
Good evening, Shannon. Mike, with Governor Cuomo saying he sees signs New York is having some success flattening the curve of the illness, I asked Governor Raimondo today if she's seeing signs of that in Rhode Island. Her answer, not yet.
For 5 weeks, our lives have been turned upside down.
40 days after the state reported its first case of COVID-19, another 8 Rhode Islanders succumbed to the disease.
The age range for these 8 people was wide.
Among them, the state's youngest victim so far, a 20-something resident of a group home who had underlying health conditions. Meanwhile, the number of people hospitalized with coronavirus, a closely watched number, has doubled in less than a week. The governor still not willing to share a projection of when the outbreak will peak locally.
And I'm reluctant, frankly, to put numbers out there that I don't have a higher degree of confidence in. And right now, I can tell you we're going up the curve. There's going to be a lot more people sick, a lot more people in the hospital, and our peak is sometime mid-April to mid-May-ish.
Total cases also racing higher, but the governor says that's a product of something positive. Rhode Island now has one of the highest per capita testing rates in the country.
First step in getting this economy turned back on is widely available, fast, accurate, free testing.
With more people confirmed infected, a tougher approach to enforcement. The governor signed an executive order today allowing the state to fine anyone who violates the health department's requirements to isolate or self-quarantine.
You know, I want to be clear. This isn't, we don't want to punish anyone. But we're also very serious about this. And if you are found to be deliberately, knowingly, purposefully, repeatedly violating your quarantine and isolation, well, then you will be punished.
Now, the exact amount of those fines for violating a quarantine order are still being worked out, but the governor says they'll be in the hundreds of dollars. Coming up new at 5:30, the health department director explains exactly what it means when people are told to go into either self-quarantine or isolation. Live at the State House, Ted Nesi, Eyewitness News. Shannon, under that new executive order, Rhode Islanders could be fined if they fail to follow a directive to either go into isolation or self-quarantine. And today, Health Department Director Dr. Nicole Alexander Scott explained exactly what it means when people are told to take those steps.
Isolation refers to staying at home when you have symptoms. Quarantining is when you're staying at home and you don't have symptoms, but you are staying at home to monitor yourself for symptoms. Both processes require staying at home. With isolation, it's important to be able to isolate yourself even within your home to the best extent possible. If you go into isolation because you are feeling sick, you should stay at home and in isolation for a minimum of 7 days. In order to be able to say that you have been cleared of your infection, whether COVID-19 or otherwise at this point, on top of staying at home for a minimum of 7 days since the time your symptoms started, you also need to be fever-free, have no fever for 72 hours. That's at least 3 full days without the use of any fever-reducing medication. And all of your symptoms need to have resolved completely. If that happens, all of those things happen within that 7 days, then that's the minimum 7 days time frame. If it takes longer, then you need to continue to stay at home until you've had at least 3 days with no fever, without taking any medications to prevent fever, and you need to have your symptoms have resolved during that time frame as well.
And officials confirmed today that law enforcement will be involved in pushing the governor's executive order. They said they've already had some reports of people who haven't followed the directives. Live at the State House, Ted Nesi, Eyewitness News.